Hello, everyone. Welcome to this special edition of AI for Good Fireside Chat. My name is Bruce Huang. I am the director of the master degree programs in information technologies, which is including data science, cybersecurity, computer science, digital media design, and creative AI, system engineering. Today, we have a special fireside chat session. Now, this is special because I'm surrounded by 5 highly talented practitioners in the field of medical and healthcare. We are actually in the middle of a data science and artificial intelligence residency for the pre-capstone. Now, every time that we run this pre-capstone residencies, I got so excited. I got so excited because I always run into special talents from our students, among our students. And this year, we have some extremely talented professionals from the field of healthcare. We have practicing medical doctors. We have neuroscience researchers. We have biomed healthcare professionals. We have AI professionals. So taking the opportunity while they are on campus, and I thought that maybe it's good for us to have them together and have informal conversations, talk about the future of AI, and perhaps that get their perspectives on how they are using AI today in their professions. I'm going to turn it over and to the 5 talented students from our cohort that is doing the pre-capstone residency at the moment. I'm going to have them introduce themselves. You want to start, Diane?
Sure. My name's Diane Kuhn. I'm an emergency physician and also a data scientist and researcher at Indiana University.
Hi, I am Monish Kashiwar. I work as a data scientist in a healthcare company named as Siemens Healthineers, and I work in the nuclear medicine department of the company.
Hello, my name is Jaimara Gonzalez Pinedo, and I work as a research associate at the Mount Sinai Center, the Wynn Center for Research for Alzheimer's disease and other dementias.
Hi, my name is Crystal, and I worked at a B2B SaaS startup company that is related to healthcare. And my background is a registered medical sonographer, and I've been working in data science for 4 years now.
Hi, I'm Michael Woodburn. I'm a medical doctor for Australia. I'm a general practice trainee working in clinics and in the nursing home.
Thank you. Wow. Look at those backgrounds. And we have an extremely talented cohort here. And this is 5 of them in the field of medicine. We actually have other students in the cohort are very talented in other industries as well. So now, after listening to their background, and perhaps that this is a natural question that we can ask, maybe that I have you share with us. I mean, you're already successful, right? I mean, you are successful practitioners in your field. Why? Why this program? Why data science and artificial intelligence? Diane?
Sure. So I think the thing that makes you want to go into medicine, at least for me originally, was intellectual curiosity and the feeling that it's something important to do with your career. And I think that's the same reason that I wanted to learn more about data science, is that I think it's changing the way we do things in society, and it's something I wanted to understand. I do feel like you can do a certain degree of independent learning yourself, whether it's a little bit of Python coding or a little bit of web systems or whatever it is. But to have the foundation and to have the structure, I wanted to have a broader perspective, and that's why I came here.
So for me, I already work in data science field, but it's more like coming to the basics, learning about what are the other ways in which the same methodology other industries are applying, and taking inspiration from them and improving the health side.
Well, in my case, I like to say that the program picked me more than I picked it. I I wanted to continue with the graduate studies in statistics, and I wanted to increase my knowledge and be able to implement these techniques into our research. And when I came across this program, I read and I realized that this is exactly what I needed, what was missing to be able to help with the research in healthcare. Yeah.
So originally I came onto this program because I could see that it would give a huge advantage in research projects, being able to work data. That was often the missing piece. That the team had people that understood the clinical content, but once spreadsheets became involved and statistics, their project really slowed down, and I thought I could be the person who could pick it up from there. Since then, I think the reason I've kept up with it is we have all these amazing AI clinical tools which are coming into vogue, and this subject helps me stay abreast of the latest developments and also helps me keep an eye for projects on the horizon that will probably become very clinically useful.
Well, thank you. And Crystal, I mean, you're in a very unique situation that you were a healthcare practitioner and now data scientist. And what inspired that transition?
I think in working in healthcare is very rewarding and very valuable experience. And something I wanted to make a difference is that when I'm doing patient care, it's one patient at a time. And by looking at like the amount of data that we have with all the patients, I wanted to expand that skill and be able to help form solutions that can benefit more patients. And I think the data science has definitely in making that extension for me and learning different methodology across different industry experience as well. It's something that I think we can benefit for the healthcare of AI.
Wonderful. Well, maybe that we can shift to the topic of the day, right? I mean, let's have a conversation. Let's have conversations on AI. Now, I mean, you practitioners are in the field. What have you seen? And I mean, of course, I mean, everyone's talking about AI, and AI is the talk of the household. And in healthcare, it's no difference, right? So how much of this is hype? How much of it is real? And what have you been using? What have you seen AI being used in your everyday practice, right? And so maybe Michael?
Absolutely. So look, here's one thing that's absolutely real, the AI scribes that are coming in. So everyone's been in a Zoom meeting and had their meeting recorded and then had the AI generate a summary of the meeting or a transcript. And that transcript and the summary are both very useful. I think the new thing is that you now can walk into a doctor's office and be offered the same service. So the doctor will record the consultation, and then from that recording, a medical note is generated. So it's entirely changed medical documentation. It's made it a lot more efficient for the doctor to document. I think that allows the doctor to focus on the patient more. But it is also handing a task that was previously in the hands of a health practitioner over to a large language model. Overall, I'm in favor of it, but it is quite a shift for a patient to now have the expectation in some doctors' offices that they will be recorded during the consult.
Yeah, would there be a lot of concerns, right? I mean, like, for example, Diane, I mean, you are a emergency room physician, right? Medical doctors for ER room. And so the patients, when they come to see you, and like, that's emergency. And so when they have concern about that conversations being recorded by AI?
I think there will be concerns. It's not something that is happening regularly in our department yet, but it is happening in a lot of places. And I think what I would advise patients is that there's actually a risk either way. So if there's no recording, then there's a risk that what you've said or what happened during the meeting wasn't accurately captured. Doctors do their best, but especially in a setting like the emergency department where we could be running from one urgent situation to the next without documenting anything, potentially for hours at a time, we may miss a detail that you shared that you felt was important about your history or your symptoms. And if that could be more accurately captured, then potentially the risks, the benefits may outweigh the risks in many of those situations. So I think certainly it's something that, at least for now in the emergency department, should be an explicit conversation and an explicit consent. But I do think it's something to consider being open to. I think I would be as a patient knowing the trade-offs.
So besides recording and making the documentation more efficient, right? Are you seeing other things being used, especially like in the emergency room? I mean, that's fascinating, right? It's like the doctor has to work under pressure. Can AI help?
I think that it can. I think that one of the ways that I'm seeing it being used so far is with concerns about interoperability and ability to pull in information from different charts that may be relevant. I've seen less progression in terms of within the actual electronic health record for some of the things that could be time saving, where it might review old documentation or old records and pull relevant lab values, potentially providing a summary and a chatbot, things like that. And I think one of the challenges that we're facing with making those steps of progress is that this isn't just an optimization problem that we know we can solve with models. It's an issue of accountability and of liability, regulatory issues. There's a whole set of rules and policies that exist for good reason that will have to be integrated and considered to make some of those steps forward. I do think they'll happen at some point.
Wow. Marius, I mean, you're in the industry, right? So, I mean, you're working on product, supporting the healthcare industry. So can you talk a little bit about what you're seeing?
So we sit somewhere in between a patient and a doctor. We need to serve both the sides. So for a patient, the main concern is how fast can they get scanned. So like if you are already suffering from a disease or some illness and you went into a CT scanner and now you need to wait there for, let's say, 1 minute also, but the patient is like, no, I want it quickly. So we need to serve that side also, and also we need to be accurate enough so that doctors can trust us, and we can't ever take the doctor's position, but we can surely assist the doctor in taking better decisions. So in case of like nuclear medicine from the department which I become, so here we are mainly dealing with cancer related stuff. That's a very big topic in us. So here previously what used to happen is doctor used to manually check, yeah, this is the metastasis, this is not, this is. So here AI comes into the picture. They are able to say, yeah, we are pre-highlighting all the things. Now the doctor with their practice and other abilities, they are able to see, yeah, this is correct, this is something you are missing, and this needs to be. So we need to speed up that process also, and on the other side for the patient satisfaction also. Also, what this is on the deployment side of the thing, but on the other hand, what we have seen is machine is a machine at the end. It can break down, but in the start, if you have queued so many patients that this will be scanned after this, so there is a patient frustration also. So on the other hand, when it comes to the customer service, here customer being our hospitals, we are trying to bring such technologies that machines can self-identify, yeah, I will go in a down state or something like that, and we give a preventive care to the machine, here machine being our patient for us as a healthcare company, and before disrupting any of the hospital's workflow, we come here, we fix it, and we get out so that no one is affected. So these are some of the areas in which we are looking. So fast up the scan process, give better recommendations to doctor, and speed up the service life cycle.
Samara, what do you see? I mean, it's like in neuroscience research, right? Has AI changed the way that we conduct research?
Yes, it has definitely advanced and make things faster and more accurate for research. I see it a lot in the neuroimage area where they have been able to, using machine learning and using deep learning, predict if a person can or will advance from mild cognitive impairment into dementia before any doctor can actually see it. I also saw this very interesting study that they were analyzing voice of different patients from a study. It's called LEADS study. And they were able to pick and determine if the patient was progressing into dementia or into mild impairment, looking at their voice and the inflections of the voice. So there's so many things. We can see it also in pharmacology. It helps with new scientific discoveries. We get data from images, from biomarkers, text data, and we can put it all together to advance and make things happen. So it's still very in its infancy. There's a lot more to go and to do, but it's really helpful, and it will if we can make it safe, and if we could make it more accurate and more explainable somehow, it'll make a huge difference.
Appreciate that. Thank you very much for sharing. And so, Crystal, I mean, now that you're doing data science work, and that based on your knowledge and what you did previously, what AI is suitable to solve?
I think there are a lot of different areas. But where it's most impactful at the current stage is some of the workflow burden that the practitioners are experiencing. So kind of similar to what Michael and Diane has shared, a lot of the administration burden comes from documentations, information intake, and also the process of trying to get the patients to the right medications and treatments. And a lot of times, maybe it may be United States, but I'm not sure how that goes across different countries, but insurance is a big thing that we had to go through a lot of process and paperwork. And having the AI in part of this process to help speed up this unnecessary paperwork, sometimes it helps to kind of get the patients the treatment that they deserve fast in a more efficient way.
Fascinating. I mean, all the changes, right? I mean, AI bring to us, and are there something that, I mean, regardless, right, and it's not change or not changeable? Is there anything in your profession, in your practice, is not changeable by AI? Anyone?
Sure. I think there are things that are inherently human that I want to stay human as a patient and as a doctor, which is, there are conversations in the emergency department that are about end of life or preferences or people's feelings and emotions in a particular situation. And that's not really an optimization problem. That's a human problem. And just two people discussing a difficult situation or circumstances that are changing their lives. And I think if we were to try to involve computers in that, it wouldn't necessarily provide a clearer decision or a more optimal framework. It would take humanity out of something that was never meant to be perfect. So I don't think I would want AI in those situations.
Yeah. So, I mean, when a patient comes in to see a doctor, and I believe that there's a lot of emotional support the doctor can provide, right? And so in that sense, I guess there's no way that AI can replace that doctor's emotional support to the patient. Is that true, or?
I think that there are situations where I wouldn't want it to. My understanding is that many people are using large language models for emotional support or for therapy assists, and I think that in certain situations, maybe that there could be a benefit, but it's hard for me to imagine that I would ever want, and I think most patients would ever want, to come into an emergency department with a very serious situation for themselves or a family member and have a large language model providing the emotional support for that situation. I can't really envision that future at the moment.
Yeah. Well, so what concerns you the most, Michael?
What concerns me the most about AI? Data privacy. Data privacy is a big one. Medical records, they're sort of sacred in how they need to be protected. Large language models are often cloud hosted. I think that the data that goes into large language models is an attractive target for bad actors. So the thing that I worry about is that people are sharing their personal data with AI. And although the explicit privacy policy of the company they're sharing it with may sound like it's secure, the reality of, the international cybersecurity and cyber threats means that it's perhaps not quite as safe as I think it is thought to be. That's my concern. Yeah.
Yeah, data privacy is a huge issue, right? It's not just in healthcare, in just about any professions. And yes, are there any surprises? Are we seeing something that AI is doing that we never expected it?
Like, I feel like some of the breakthroughs, like from Google, AlphaFold, it was a very big achievement, which at the end, you need to verify whatever protein structures are, but it was able to narrow down how many iterations you need to do or how many combinations you need to think about. So I guess so that was one of the very big achievement, and it helped a lot in the field of protein folding and biochemistry. I feel like that. And in similar ways, like, you need to think in a holistic manner. You can't ever replace a human, you can assist the human. So if we are able to treat the AI in that way, that we are assisting the doctors, we are assisting the radiologist or XYZ person, it is a very good assistant. That's what I feel.
Okay. Zamara, you see like any challenges using AI in neuroscience research?
Challenges for us, yes, it'll be the data access, the data privacy, especially in healthcare, because it's very hard to get access, and also in the US, the data is scattered. It's not centralized, and so if we really want to have a comprehensive set of data to create any models or to solve any problems, we will be missing data because patients or participants often don't have the information in one database or in one hospital. So that is a big problem that we have, and I'm concerned about biases with these models more than anything, because depending on the data that we get, it will influence the biases that these models will probably have, and depending on the problem that we're solving. So that will be the biggest problem that I think we could fix in the US. It's being able to access data or provide data for the researchers in a safe way, of course.
Crystal, you see the same thing, or?
Yeah, very similar. And I think the concern that we had before was also the bias in the model, given like the limited access we have for the data. And that will not just because of the model performance, but it will influence the trust from the patient and the clinician based on the model results.
Okay.
Also, I feel one thing, the data localization is also a very big thing. So the model which is trained on US data will not serve in Asia. So that thing also need to be figured out, how we can have localized model for. I feel in healthcare it will become a big thing, because in USA in general, the body appearances and body diseases and other things are very different what we are in Asia or where Europe or Africa. So you can't just pick and push it. You need to have some kind of retraining towards that specific catering.
Now, in academic, we tell our students that if you use AI, you need to disclose it, right? So what about in healthcare? Now, as a practicing medical doctor, what does a patient need to know? Do they need to know?
For an AI scribe, absolutely. Because you need to get consent, first of all, to record them, which comes under its own legislation. And secondly, the patient needs to be aware of what the AI is doing, that the AI is interpreting a transcript and is then generating and editorializing in its own note. So, you know, if you're the patient, you do need to know those things. Now, the tricky thing is that there are further AI tools that could be used that the patient might agree to, but are not legitimate under the governing medical body of that country. So in that case, it's almost, the doctor shouldn't even raise it. The patient can explore those themselves. But again, I think it's very much buyer beware. You know, it's a fraught area, and patients should proceed with caution in using any AI tool to interpret their health.
What about you, Diane?
Yeah, I think there are areas where we can probably agree that I think research and clinical work would proceed in the same direction. So kind of the idea of having more centralized data, ideally that would be more complete, would be helpful for clinical care and also for research. But I agree. I have a lot of concerns about potential bad actors, any sort of cloud-hosted platform, and the ability to keep things private, or even well-intentioned individuals working in healthcare or ancillary services that just don't use an adequate amount of caution with downloading or analyzing data. I have worries about those things as well. So I agree. I think it's sort of a buyer beware situation, both for patients and for individuals working in those fields.
What about this trust issue, right? And so let's talk about doctors first. Are doctors trusting AI? Are they still skeptical, or are they trusting AI more now versus like 2 years ago? What do you see?
I don't see doctors using AI tools for clinical decisions. I certainly see them using it for research, for literature reviews. I see them using it in administrative capacities to summarize meetings and things like that. But I think at the moment, it wouldn't be considered, first of all, it wouldn't fall under the governance for most institutions and potentially at the national level legislation. But it also doesn't fall under yet what would be considered standard of care, which is kind of a legal term in the US medical profession where it's what would be reasonable for another doctor in that position to do. And I don't think most doctors would believe that using an AI tool for clinical decisions at the moment is what most other doctors would consider reasonable. And that has implications for medical legal standards and accountability and all sorts of other things. It's kind of challenging because it's a little bit circular in the sense that it becomes medical legally acceptable to do what other doctors are doing, but you can't do that until other people are doing it. And I think that element of circularity is why uptake of innovation and new tools in the medical industry can take some time. But I do think that's a good thing as well, because sometimes there are minor things that you would want to have established or sorted out before it is ultimately involved in clinical decision making.
Thank you. And now, Crystal, I mean, going back to the days that you were a practitioner, and what does it take for patients to get more trust in using AI, right? Or trusting the doctor to use AI, or healthcare practititioners, whether doing sonogram, monogram, and those kind of things?
I think it goes back to what Michael was saying too. It's about what they wanted to know about what AI is doing with their data. And if I were still a sonographer today and I do see the usage of AI, I do wanted to know that if the the clinical decision made if it's using AI, if it's accurate, how can I trust the AI decision versus a human? And so I think that's a very interesting trust issue to discuss as well. And
there's a lot of ethical considerations, right, when it comes to using AI for medicine. And Michael talked about the recording and conversations between doctors and patients, and that we need to make sure that patients actually understand how long that conversation is going to be kept, right? And where is that conversation going to be stored? It's going to be accessible by someone else's, and so all those are things that we need to consider. So what does the industry is doing in that area, and is there some kind of a framework or governance that the industry, when they put those AI products out there, right? Are they doing anything and to help to alleviate the concern?
So here the main concern which we see is the explainability of the AI, why it has given such recommendation also. So we are trying on our side how well we can explain. Yeah, we say that this cell is a cancerous cell because due to these factors which we observed, and now doctor has the freedom to say, yeah, this explanation was right, I can consider this, but this is where something wrong, and they can give a feedback that no, this is how it should be, this is wrong thing. So it's more on the terms of how well we can explain from the industry side whatever the AI is saying. So in that sense, we are trying to build things which are explainable in nature.
Very, very good, very good. And so, I mean, obviously that you think that there's a future for AI and data science. That's why you're here, right? So what can we expect? What can we expect the adapting of AI technologies in the field of healthcare? What will we see in the future? Zamara?
Well, I will definitely like to see AI used in preventive medicine. It will make a huge impact. I would like to see that as standard of care. And I think it could happen if we get access to enough data, and it will make a difference for healthcare practitioners and for the patients as well. For example, in Alzheimer's and other dementias, it's important to catch the changes in the brain before. Sometimes even it's possible before even the clinical manifestations are observed, and if that happens, they can intervene and potentially cure or help or extend the lifespan of the patients. And I think that would be awesome if we could focus on that area.
What about you, Diane? I mean, what do you see in the future, or what do you want to see in the future?
I think one thing that I'm very hopeful for is AI within an individual patient's chart to identify opportunities for preventative screenings. Also, even just kind of what might feel like minor things, such as maintenance of the record, cleaning up problem lists and other things that may duplicate each other and create confusion and also difficulty with coordinating care. Sometimes you'll find in one place that somebody is listed as having had a smoking history, and then quite in another place you see that they've never smoked at all. And I think when you have those types of contradictions within a record, it's a very easy opportunity, sort of low-hanging fruit for AI that would also help clarify what appropriate preventative screenings would be indicated. I think one area I'm less optimistic for AI is that there are a lot of stakeholders in medicine and in healthcare, and many of those stakeholders not only don't have the same objectives, but they have competing objectives. And so imagining kind of an optimization problem where patients, doctors, hospitals, public health systems, cities, payers are all trying to achieve very different things, sometimes directly in conflict. is not easily solved by the best model. And so I think that's one area where my expectations are tempered for achieving things like cost efficiency and minimizing financial toxicity and some of the other objectives I think that we have as a society.
Well, let's go to Australia. What do you see in the future?
I'll make a fun prediction. All right. So the situation as it is now is the patient comes in the room and I say to them, do you mind if I run my AI scribe? And the patient usually says yes. I think in a few years' time, the patient will also say, do you mind if I run my AI scribe? And then I'll be put in the situation where I have to say yes or no. And the reason I think that they'll do that is I think that patients will figure out that the AI is very good at advocating on their behalf. And it's also good at keeping track of appointments with various doctors across a great deal of time. It's good at organizing their healthcare in general. And most importantly, it's able to negotiate probably more effectively with the doctor in order to advance the patient's interests. So I think that what will happen is the patients will sort of have two doctors. They'll have the human doctor who they talk to, and then they'll also have a personal AI assistant, which is functioning as sort of a pseudo doctor, which is able to communicate with their healthcare team in order to meet their goals. Now, in order for this to be legitimate, obviously there would have to be fantastic privacy controls over that AI, but I think that's coming. I think that companies will offer that. Companies will say, look, if you want an AI assistant and you want it badly and you understand how good it could be for you, we will create an environment where that data is safe. So I think that's what's coming next. Patients, AI scribes being run in the consult, two at the same time.
Wonderful. Did you see something else or?
No, I just wanted to ask the professionals, the doctors here, because now we have all this measuring machines and everybody's measuring their heart rates, and we have a wide range of instruments that we can measure ourselves. So somebody comes into the clinic and says, "Oh, I have this report from all these wearables, and this is what it's saying that I should do." How would you receive that feedback?
So I would say in the emergency department, it's a little bit less common that we see that just because we typically have unanticipated visits. It's not never, but I would say the kind of more common thing is that somebody comes in maybe about a blood pressure concern, that their blood pressures have been high, and they either have a written log or potentially a monitor log showing that their blood pressures have been high. And I don't rely on any sort of AI interpretations or recommendations that their devices may have given. I might use the raw data, either that they've written down or that the monitor has collected, which could be glucose readings, it could be blood pressure readings, and I find those to be quite reliable, including the handwritten records. But I don't think I would rely on an AI tool to provide the recommendations. I did even have one patient provide an AI description where he had provided his symptoms to the AI and asked it to craft a presentation history that he then turned his phone and presented to me. And what I found when I spoke with him is that he told me a description and a history that was very, very different than what the large language model had crafted. So right now I find the raw data reliable, but I'm less comfortable using any kind of recommendation.
Crystal, what do you see in the future?
I think one for sure is the healthcare being more accessible to not just like within the city area, but we are able to more easily triage care to more less accessible care needs for care. And also, like within the wearable, that's also something I was kind of thinking or working on in my previous experience, is if we can use a behavioral data or phone sensing data to predict behavioral and mental health symptoms, and that would be able to alert emergency and prevent serious or severe mental health issues.
Very good, very good. Now we are at the end of your pre-capstone residency here on campus at Harvard, right? So, I want to talk a little bit about that. So how has it been so far? What's the experience? Diane?
Well, it's been a little bit of a nostalgia tour for me because I lived here 15 years ago for graduate school. And so it's been really fun. I've seen a couple of my dissertation advisors and I brought my family here. So we've been doing some touristing in some of the spots that I missed last time I was here. But a trade-off, of course, because there have been so many fun things that the cohort has been getting together to do and so many social events, and I haven't been able to attend all of those. So I think probably we all just wish that there was a little bit more time and more opportunities to get to know everybody and learn from each other.
Yeah. What about you?
So for me, it's like time flies by. 3 weeks went away, and it's like we just started. And it's I will say coming back from professional world to academia, and then trying to have a conversation with the people who are from various industries, having their own perspective, having their own knowledge, own background. It's a very enlightening thing, and I will love to do that again and again in future.
Excellent.
I agree. It's been so quick, but so fabulous. I want to thank you personally because I wanted to continue with my research and get an education, and this school is amazing. I haven't had time to see everything that Harvard has to offer, and I'm just leaving like this week. I feel a little sad, but I'm very happy that I did this, and I'm looking forward to do something similar again here.
Wonderful, wonderful. Crystal?
Yeah, sure, the same sentiment. I think being able to work full-time and then have the flexibility to still receive like a quality educations and then be able to meet different professionals, physicians, and then researchers, also engineers, to get their perspective in both like industries and also academic. I think it's a wonderful experience.
Excellent. All right. And this is like a long way from Australia. How has it been?
How has it been? When I first stepped off the aeroplane, not great. But look, after a few days, fantastic. Meeting the cohort was great because you know that everyone has been working really hard, you know, wherever they've come from, and that the work required to get through the masters is substantial. And so it's really interesting when you arrive, you think, okay, well, who's in this room? This is the type of person who's able to work for a very long time, very hard on some very challenging problems in order to get to this point. And I've just been blown away by the level of intellect and creativity across the teams. It's been a real pleasure. And to come here during FIFA, I mean, that changes things completely because the truth is the dates that we're here, right? The amount of soccer games that we've watched has been amazing. Yeah, I've never felt so involved in the World Cup.
Excellent, excellent. Yeah, I mean, this is a very special cohort, and not to mention the talents that we have. And this is the cohort that actually here on campus, while the World Cup is going on, and as well as celebrating America's 250th birthday, right? So this is amazing experience. And so, I mean, you're not here for the World Cup. You are not here for the activities that we have, and you're here for the capstone, right? So let's talk about the capstone a little bit. So I know that the three of you actually working on the same capstone project. Can you share, I mean, like it's some high level overall? What are you doing? What are you trying to do? What are you trying to accomplish?
So it's with association with a company named 136. It's an Australian-based company and which is trying to provide accessible healthcare via telehealthcare calls or via in-person visits in off hours. So when there is no one and you need someone, you can consider it as a 911 of USA, but it's more on I am feeling a throat pain. What can I do and how can I consult? So it's on that accessibility level, and it's somehow funded by Australian government also in providing accessible healthcare for everyone. So one point which was drawback was in-person healthcare visits were very less than what they were able to serve via telehealth. And we as a cohort, like we as a group in the cohort, trying to resolve or trying to give some suggestions in which they can serve more in-person telehealth, in-person healthcare requests. So how can we bring doctors and the in-person calls together in same wavelength so that it can be served better? It's on something on, we have just started it on, we are seeing the data, and all of us are having, one of us is economist, I am from data science, this both are people are from the practitioner side. So we have a very good group, and we are trying to bring economics into so that the platform also becomes sustainable. More of the patients are able to be treated, and doctors are also rewarded in same way. So we are trying to do in some way that what are the measures we can do.
Wow. Anything to add, Diane?
I think that was a really good description of it. And I think we've really benefited both from having Michael, who works with the company, and also so many different group members coming from different disciplines. And we've managed with 6 group members to cover 6 time zones as well. So I think that there is a lot of asynchronous work in our future.
Wow. The capstone project is amazing, right? I mean, and I think this is definitely something that trying to solve a problem, a life problem, in terms of the availability of the doctors and the aged care, right? And yeah, what you think about?
Can I say something controversial?
Sure.
I think there should be a pre-capstone. I mean, so we had one person come to the pre-capstone, and sort of on arrival, he just had an idea and he tried to get a team together, but the foundation of the project wasn't quite there. I would love to see more people come with some data and a startup idea, so that when they arrive, teams sort of coalesce around them, and we get kind of like a Mark Zuckerberg Facebook situation, but for the pre-capstone. But the difficult thing is we roll directly out of a sort of a subject into the pre-capstone. And I think that there's a lot of room to kind of motivate and sprinkle the idea into the cohorts' minds, that there is startup potential here. And that I think that there could be startups that come out of the pre-capstone, but they just need to have the foundation and the data ready.
Sounds like there's a startup that's cooking.
Well, would you ever consider doing a subject as part of Harvard Extension, like Guide to Startups, how to get going, or how a startup is made?
Well, I mean, I think this is natural, right? And that over the last 4 years, we actually have, I think that probably like a handful of the capstone projects actually turned into semi-finalists for the Harvard President's Innovation Award from the iLab. And the cohort just graduated, and we actually have a one of them that actually made it all the way to being the finalist for the Harvard President's Innovation Award for the startup, right, and iLab, and we do have a one of the capstone project that they were focusing on medical coding, and at the end, like 2 weeks before the end of their capstone implementation, they actually receive seed funding for the startup. But that's a great idea and a great thing. And we always encourage students that to take a look at what they can do in the capstone, and then is there a potential opportunity, right? And further develop that, whether it's a startup or doing some future work. Yeah, that's excellent. Now I know that Zamara and Crystal both working with NVIDIA on the capstone projects. How is that one?
Can I take this one?
Well, it's we've been definitely learning a lot, even just doing pre-capstone, like doing a lot of the research, given we're from very different domain, and But it's been a great experience so far trying to understand the problem that they have and what we're trying to bring to the table. Like it's a good application of all of our coursework to into the project.
We've learned so much in the last couple of days. We've been meeting with our sponsor and getting a lot of information, and it's been a lot of learning. I knew it was a capstone and pre-capstone and we were going to learn, but I didn't know I was going to learn so much, so many new ideas and new technologies. So yeah, we're very excited.
Excellent, excellent. And I mean, this is the first time that we actually bring NVIDIA in and as a capstone project sponsor. So it's good to hear everything's going really well. Well, let me close by asking a last question here, right? And so if we come back here for reunion in 10 years, right? 10 years from now, what is your prediction that if we come back here in 10 years, what can we talk about? That's something from AI has been a reality in the field of healthcare. And that's something that's actually surprised a lot of people today. Who wants to start?
I will say that in future, like 10 years or so, AI become much more acceptable in terms of trustworthiness from the doctors, from the patient side. In general, what we have seen is in 2022, when ChatGPT came up, it was very bad at doing mathematics and other things. It used to predict the next word. Now it is able to bring the thoughts in, it is able to have the previous knowledge. And as the users is increasing, people start first reaching to the ChatGPT or any kind of AI model. Yeah, I am facing this problem. Can you help me with this? And now that trust which they are able to give to the LLM model, future I don't know whether it will be just LLM or where it will be something different, but that trust becomes bigger and bigger. And as Dan said that there is a very different reality between what she heard from the patient and what the AI generated transcript was for it matches closely. And if the patient is not able to tell something, AI is able to highlight, yeah, you have missed this thing, and doctor can proactively take that thing also in consideration and able to treat the patient as soon as possible, so that patients also suffer less and doctors also are able to give good decisions to treat patients well.
Very good. Anyone else?
My hope is that it will get used kind of on the public health side and health-related social needs. I think one of the biggest areas that we can improve for patients and for our health outcomes overall in the US is a lot of preventative things. And so I'm actually really hopeful that it will be able to help patients with individualized health plans that aren't necessarily medical plans, but just health plans where it may involve mapping out routes or kind of a very accessible like 10-day plan. And a lot of those things exist already in various forms for payer programs and other things. But I think people have really taken to the idea of wearables and being in charge of their health. And I think centralizing kind of a personal customized health plan in one location that involves steps or whatever it is, I think ultimately will probably be maybe not exciting, but one of the biggest differences we can make.
I like that one. I really like that one, right? And so it's basically AI has captured everything that I guess from a very young age, and as we grow, and then can basically personalize and customize a health plan, right? And help prevention or illness prevention or just being healthy, right? And health plan.
Knows what parking garage, usually you work here, you go to this parking garage. Hey, I would suggest that you park on the first floor and take those stairs on the left and do that at the beginning and the end of your day. And by the way, that's this amount of walking each day. Those types of things that feel very personal. And again, maybe not the most exciting, most glamorous uses, but I think probably the biggest contributor long term.
Excellent. Michael?
I mentioned before the personal AI assistant acting as an intermediary between the doctor and the patient. If I had to have a second guess, I would predict that AI will lead to a revival of genomics, basically, and gene therapy. I think that the relationships between genes and outcomes right now is a little bit fuzzy. There's not a direct link between having a gene and then necessarily getting a cancer. There's a statistical link. I think that AI will make it a lot less fuzzy. And I think that in 10 years' time, when we all gather together again, there'll be a lot more talk about what genes we have and perhaps like what genes we'd like to have and what gene therapies we're considering. I think AI will shine a light on that area.
Excellent. Yeah. Crystal?
I think AI will most likely change a lot of our testings or like lab functions, depending on how the data is gathering and how we're actually processing and building models around those health data right now. We might have some discovery that it might be a different test that or lab that we are needed, or imaging, where sometimes there might not be imaging needed if we have certain data and limitations. And so I think I'm hoping that will be somewhere AI can go through to, so that we can make the healthcare and treatment plans more accessible.
Excellent. Samara?
I definitely agree with their takes and what you guys have said. And maybe this is NVIDIA talking, but I think I would like to see a little more physical AI in healthcare, especially, and I know there's been some research and some things going on right now, but people who have been through accidents or who have strokes and they lost mobility, or I don't know, I just can imagine this world where you have an accident and you paraplegic and now you can just walk because of AI. That would be awesome, I think.
Oh, absolutely. Absolutely. And in the previous cohort, we actually have teams that work on basically detecting signals, right, and from a brain, and which is we see some of the projects going on today that can basically leverage that and helping people to gain some of the capabilities such as like speaking and walking, right? And we also have students work on projects such as like AI for the disabled, and how can we give them the mobility again. And I think those are possibility. So when we talk about the physical side, and so my thinking 10 years from now I don't know about the acceptance yet, but maybe that we will be seeing humanoid nurses, caregivers, or even doctors. Is that possible?
It's hard to predict the future. I think there are still things that I want to keep human, but views change, and perceptions of what's possible change over time too.
I mean, obviously, there's a lot of ethical considerations needs to be given, right? But in 10 years' time, I hope that we will basically address a lot of those issues, and the possibility of having a humanoid nurse, right? May not be the doctor, but like a assistant, a caregiver that might solve some of those shortage problem that we have in nursing. What do you think, Michael?
I'm sure you're correct. Because, I mean, first of all, we had Boston Dynamics here in Boston, and then I've seen the conventions recently in the last few years of humanoid robots being demonstrated, especially in China. And, like a lot of nursing work is basic tasks like sheets, food, bedding, moving clothes and things like that. I think that the humanoid robots will begin to take over some of that work. Whether they can take over all of the work, I'm not sure, but I think we're definitely at that point. And given the number of people who will need quite attentive nursing in the next decade in nursing homes, I think that the market forces are there to make it happen.
Yeah, absolutely. I mean, I don't think it will be basically that taking over every single task that our nurses and caregivers are doing today, right? I mean, things that we talked about earlier, like the emotional support, and that's still a human's thing, right? But I think that there's a lot of the physical task, and perhaps that will be overcome, and definitely there's a lot of ethical considerations to be think about. That's what we talk about in classes, right? And so, well, this has been a great and excellent conversations. So thank you very much, and for sharing your knowledge and sharing your perspective as a practicing medical professionals, healthcare practitioners, researchers, and AI professionals. Yeah, this basically concludes our program. Thank you very much.